Sign and symptoms of tonsillitis. Tonsillitis is of two types: acute tonsillitis and chronic tonsillitis. When the acute episodes, they are three in number in 1 year, in the past 3 years, then it is termed as chronic tonsillitis, because the lymphoid tissue, they become useless and harmful, because they become the residents of the pathogens that produces exotoxins which are lethal to the health of the body. They produces complication, that is peritonsil abscess, cellulitis, lymphadenopathy, obstructive sleep apnea. So these are the indication that the tonsils has passed into chronic tonsillitis group, and they needs surgical excision. They cannot be cured by the medical treatment. The main symptom in the acute tonsillitis is high grade fever, soreness, sore of the throat, that is dysphagia. Then it causes, when the infection that passes into the upper respiratory tract, that produces obstruction in respiration, inflammation of the bronchi producing wheeze, and the difficulty in the inspiration and expiration process, that is called as dyspnea. Moreover, when the clinical examination is, that is the history of the patient, which gives the complaints of the patient. Then the physical examination, that the examination, direct examination of the tonsils by the torch light, that reveals there is swollen tonsils which are pussy, red, inflamed one, that produces pain in the back of the throat. So these are very simple procedure by which we can diagnose the tonsil has been inflamed. Moreover, there is blood examination for antigen antibodies against the pathogens. Then we send sample of blood in the laboratory for diagnosis of the causative organism, whether it is virus or whether it is a bacteria, especially for streptococcal pyogen pathogens. Next, we can also perform the throat swab. Throat swabs, they are sent to the laboratory also for detection of the pathogens. So these are the basic minor procedure by which we can diagnose the tonsillitis and the etiological factors. The exotoxin produces the complication, especially that is the nephritis, the acute post arthritic tonsillitic nephritis, carditis. Then there is myalgia, arthralgia, quinsy, hepatosplenomegaly. So these are the complications produced by the tonsil, and these are the clear-cut indication that the disease has been passed into the chronic phase and it needs a surgical excision. Moreover, it is a contagious disease, infectious one, and it can be disseminated easily by the droplet infection, that is coughing, sneezing, talking, laughing, and also the kissing one. So these are the mode of transmission of the disease. So these are the various steps that we have to adopt to check and control the spread of the disease by the preventive measures.